Magnetic scoliosis correction is a new concept for a scoliosis surgery, which is designed to be less invasive than any existing scoliosis surgery. Scoliosis is a sideways curve of the spine. In addition to the sideways curve, there is rotation, with the most rotation at the apex of the curve. Magnetic scoliosis correction uses magnetizable steel bolts to provide the correction forces. First, the bolts are surgically implanted in the vertebral bodies. The placement of the bolts is practically identical to the placement of spinal tethering screws, so there is precedent for this type of procedure. This surgery would be less invasive than spinal fusion or tethering because all of the implants can fit through tiny incisions, even in a lumbar operation. In the lumbar region, a minimally invasive approach similar to the XLIF procedure can be used. Also, the bolts do not protrude out of the vertebrae, so they won't obstruct the natural anatomy. Lastly, since there are no joints, the risk of hardware breakage is very low. After a healing period, the patient would receive regular magnetic therapy, using magnetic forces to temporarily hold the spine in a straightened position for the duration of the therapy session. The goal is to slowly correct the scoliosis over a period of months to years, incrementally correcting the deformity with each session. An electromagnet was designed which can safely apply corrective forces to the implants. The steel bolts don't generate a magnetic field on their own, but they can still be forced by the electromagnet. The magnetic field creates a strong torque on each implanted bolt, forcing the bolts to align with the magnetic field lines, all at the same time, simultaneously correcting both the sideways curvature and the rotational component of the deformity. Each vertebra will be torqued toward the correct position, and the combination of these forces will straighten the spine. To clarify, there is no sideways pulling force on the bolts, only torque, twisting the spine into alignment. This is the safest way to apply magnetic forces to a spine. A closer look at how the forces work. As mentioned, the bolts will try to align with the magnetic field lines. So, when the bolt is aligned with the field lines, there is zero torque on it, and it is in complete equilibrium. However, when the bolt is out of alignment with the field lines, as it would be in a scoliotic spine, a strong torque will be generated, twisting the vertebra toward a corrected position. The torque is strongest around 45 degrees. As the angle increases further, the torque eventually becomes zero again when the bolt is perpendicular to the magnetic field lines. However, in a real scenario, no bolt would ever be completely perpendicular. This is just to show the context of the forces. At the same time as sideways correction, the rotation of each vertebra is corrected, with the same torque principle as in the sideways correction, but in the rotational plane of the vertebrae. Again, when the bolt is aligned with the field lines, there is zero torque on it. This is where it wants to be. When the bolt is rotated out of alignment, as it would be in a scoliotic spine, a strong torque will be generated, rotating the vertebra toward a corrected position. The torque is strongest around 45 degrees. As the angle increases further, the torque eventually becomes zero again when the bolt is perpendicular to the magnetic field lines. As before, in a real scenario, a bolt wouldn't be perpendicular, and is shown just to contextualize the forces. To ensure the therapy is safe and effective, the therapy would be applied under the guidance of a trained professional. The magnetic forces would be a vital addition to physical therapies for scoliosis, giving the ability to apply highly targeted correction forces, resulting in a larger reduction of the deformity. Thank you for watching.